Hi everybody, we are here today at the Sioux Lookout Zone office and we are going to be talking about oxygen protocols level 1 through 3 for COVID-19 nursing station management. All the documents you see on today's video are going to be available by going to onehealth.ca, clicking on zones, Sioux Lookout zones, and then COVID-19. Okay, so we are going to begin with the level 1 oxygen protocol. Before we begin any of these oxygen interventions, we need to consider PPE. So for level 1 and most of level 2, we are going to be using our contact and droplet PPE. So that is gown, gloves, mask, and face shield. During level 2, we will increase to airborne precautions. So to begin, level 1 oxygen therapy. You have a patient that comes into the nursing station with saturations less than 92%. We are going to apply simple nasal prongs with a surgical mask over top. And we're going to set it to 2 liters per minute and then consult the MD on call. If for some reason the patient is not tolerating nasal prongs, once again we are going to consult the MD and we can try a simple mask, titrating beginning with 5 liters per minute up to a maximum of 10 liters per minute. Again, we are going to place a surgical mask over the simple mask. If for some reason the patient has remained in the nursing station on either the simple mask or the nasal prongs past 24 hours, we are then going to consider oxymizer, which is a nasal cannula with a reservoir system, after consulting the MD. Once again, we are going to need to apply a simple mask over top of this device. Okay, entering into level 2 of the oxygen therapy for COVID-19 nursing station management. Step 1 is going to be consider awake proning of the patient. So that means flipping the patient onto their stomach. Patients can rotate between lying on their sides, their front, or seated positions, whatever the patient's tolerating. Again, with each of these position changes, you're going to want to reassess their SpO2 levels. If available, these are coming soon to nursing stations near you, we can try the high ox mask with the viral filter. So we're just going to show you quickly how to attach the viral filter. So just slides in like that. So it only fits in one way. And then for this, we don't need to have a simple mask over the patient's face because we have all the outflow of the air going through the viral filter. So this will be started at 6 liters per minute, titrated up to 8 liters per minute. After this, if the patient is still not tolerating or SATs are below 92%, or if the high ox is not available, we're going to move on to our non-rebreather. Before we do anything with a non-rebreather mask, which is a higher flow, we are going to need to switch to airborne PPE precautions. So this is now gown, gloves, N95, and a face shield. So step 3 of the airborne PPE, once again, if the high ox is not available or if the patient is not tolerating, we are going to apply nasal prongs and then the non-rebreather and then a surgical mask. For the level 3 of step 2, we're not going to turn on the nasal prongs, but we are going to just keep them on the face in case we need to go to level 3. We're going to start the non-rebreather at 8 liters per minute, and we can titrate up to 10 liters per minute. Okay, moving on to level 3 of the oxygen therapy for COVID-19 nursing station management. At this point, we should all have on our airborne PPE, so that is going to be your N95, face shield, gown, and gloves. So step 1 of level 3 is a continuation of step 3 from level 2. So you should already have on your nasal prongs, and then over top of that, you should already have on a non-rebreather, and over top of all of that, we should have on our surgical mask. At this point though, we are now going to turn on the nasal prongs at 6 liters per minute and increase the non-rebreather to up to 15 liters per minute. So at this point, you're going to probably need at least 1 tank and your oxygen concentrator, or at least 2 oxygen concentrators. Again, none of these are increased until we consult the MD. Okay, step 2 of the level 3 oxygen therapy is going to be your high flow nasal cannula, or the Airvo OptiFlow system, which is coming shortly. This is a high flow nasal prong system that humidifies and heats the oxygen. It will be coming shortly. Once again, not to be used without MD consult. And then after that, we're going to be contacting the MD stat if this is still not maintaining sats over 92%. So all the things featured today are summarized in the oxygen therapy protocol for COVID-19. Once again, this will outline all the equipment, the flow rates, and the PPE required.